Everyone, I'm Amy from the marketing team. Today we're joined by a very special guest. This is Joshua Hambleton. Joshua, thank you for being here today.
Absolutely. Happy to be here.
So we're going to ask him a few questions about his roles with the HealthLinks, but if you have any questions, you can also leave them below in the comment and we'll answer them live for you. So my first question for you, Joshua, is what are your roles and responsibilities with the HealthLinks? Sure.
So for those who may not be familiar with HealthLinks, it focuses on the top 5% of healthcare users. A high complex group with a lot of care team members and a lot of people and agencies involved with their care. And we look at this top 5% population who essentially cost the system 2/3 of the healthcare budget, which is very substantial. And we work across about 30 different partners just in my small geography here in West Ottawa. How do we do it different around these individuals? So we focus on client goals, on the care teams, and connecting the care teams around these client priorities across that network. So my role as implementation manager is to help make that happen, and so have been involved with HealthLinks for the last 3 or 4 years, all the way from the business planning to the implementation and the evolution of the approach.
Great. What inspired you to get involved with the HealthLinks?
Yeah, so I first became interested in HealthLinks as I was exploring opportunities to work between agencies. So in my background, have worked in acute settings, primary care, community care, as well as associations, and recognized that where I'd be able to contribute the most is working in the space that there wasn't a lot of, there was greater opportunity basically to apply my skills and experience, and so became involved with the HealthLink, focused on working between agencies in the gap, where often the relationships were referral based or dependent on the patient to carry that information from provider to provider, and not a lot of feedback loops within that. So how could we work between agencies, given that we're so good at working within a hierarchy or working within an organization, working as a network is a different space and something that excites me professionally to be working.
Great. And what have some of your biggest challenges been working at the HealthLinks?
Working in a network is very different from an agency. One of the biggest challenges is getting people to think outside of their organization or the relationships within their network, and how do we go broader? So whether it might be mental health or an acute setting or geriatrics, how do we link these networks together so that we're sharing information and have a enhanced connectivity and better communication across providers? And so your question was about challenges, and one of the biggest challenges is each of these agencies has their own proprietary EMR or health record, and the way that we communicate between agencies is still the fax and the phone. So that's a bit of an archaic approach, but it is the reality. And so how do we share information and make it as real time and relevant in that environment as possible? So that's been a challenge that we've faced.
For sure. And so far, how have your care coordinators and clients been using the app at Touchaway?
Yeah. So it's in that space. It's to enhance communication. I see Aetonix working in that gap between agencies in terms of how can we have a tool that's going to be able to communicate across individuals and enhance those relationships. So whether it's sharing documents like discharge summaries, or just general updates about home visits, or updating something that we call the coordinated care plan, those pieces are used by our care coordinators. Additionally, a big challenge with healthcare information systems is they don't include the patient, and they don't include informal caregivers. And informal caregivers especially, provide the majority of care for the chronically ill, and yet aren't included within the health system. And so how do we do that? Aetonix allows for a way to have informal caregivers as part of the care team with access to the care plans and to the broader professionals, in addition to the client. So with the partnership between Samsung and Bell, providing tablets in clients' homes, that connectivity, cellular connectivity, has enabled clients who would otherwise not have any other way to communicate, whether that is not having Wi-Fi at home or internet, to not having a phone. So things like follow-up, education, just confirming appointments, those kind of pieces would not otherwise be done for this subset of the population.
Sure. And along with them, do you also personally use the app for anything?
I tend to go to the app around sharing different client information with those care teams, with those care coordinators. Most of my work is at the program level, not at the direct care level. So I'll be involved with how do we engage the care teams to take advantage of this particular tool more. So we have several different sub-projects underway in terms of enhancing diabetes management, involving the dietitian in some of that, COPD education through the app, trying to connect those who would not otherwise have time to get outside the clinic or outside the hospital, connect them into the home for care conferencing with the care coordinators. So those kind of initiatives and the process around that is where I focus most of my time, and learning from those who are more actively using the application in terms of how do we enhance that and take their experience to others.
Definitely. And you've probably heard from family members, care coordinators, clients now. How has their experience been with the TouchAway?
Yeah, and it ranges. This is a new technology. Sure. So both in terms of whether it's the care coordinator, the care teams, the clients, we have different levels of engagement. But I've heard all the way from one end that even having the tablet there is a comfort and a reassurance for clients. So despite having, say, low usage on the app itself, it's just the knowledge that they can be connected should there be a challenge that they come across where they need to reach out, all the way to very active users, whether it's connecting with their care team or connecting with their informal care team. And a great story that I heard recently was this woman who was able to be connected to her daughters who lived across Canada, one on the East Coast, West Coast, and I think someone in Calgary as well. So this woman was able to not only connect with her family and her daughters, but be able to share, see their apartments for the first time due to not being able to travel and that kind of thing. So those kind of quality of life factors are sometimes overlooked, but really enhance the client experience and wellness in the broadest sense of the term.
Great, for sure. And finally, what do you see for the future of Aetonix and a TouchAway?
Right. So I think we're just beginning to learn about what the advantages are of using a technology like Aetonix. I mentioned a couple of the projects that are underway, and people are really getting excited about having the opportunity to explore how to use the technology. So I think as that process becomes more and more refined, as people get more awareness that there is this opportunity to connect through a mobile device, that you're not limited to other providers within your organization or your sector, but we can connect more broadly. So things like connecting to provincial EMRs like the CRIS system, which is the Home and Community Care EMR, is a big advantage, where we keep our coordinated care plan, and that's the client care plan that allows for that electronic sharing of this document, which is helpful. Additionally, here locally within Champlain, there's an e-consult program to connect general practitioners with specialists. How do we interface with that? So in the same way that the HealthLink is really working in space that is a gap between agencies, Aetonix has the same opportunity to work in that gap where we don't have communication tools to be able to work the way that we need to in the future. So that's the opportunity for Aetonix.
Awesome. Well, thank you so much for being here today with us.
Thank you, Amy.
Thank you everyone for tuning in. We hope you have a great day.